Hello friends, myself Triveni, Department of Pharmaceutical Chemistry, working at Raghavendra Institute of Pharmaceutical Education and Research, Raipur, Autonomous, Anantapur. Now I am going to explain NSAIDs, that is non-steroidal anti-inflammatory drugs. First of all, we have to know about what is pain, what is analgesia, what is inflammation. Pain means the body is made aware of the presence of tissue damage. Perception and reaction are the two components of pain. The process by which pain is recognized by the brain is known as perception. Involuntary response to the sharp pain is known as reaction. Coming to the analgesia, that means a relief of pain without loss of consciousness. The drugs which are used to treat that condition are known as analgesics. These are mainly classified into two types: narcotic analgesics, also known as opioid analgesics; non-narcotic analgesics, also known as non-opioid analgesics, or NSAIDs, that means non-steroidal anti-inflammatory drugs. Coming to the NSAIDs, NSAIDs are the class of drugs that relieve pain, reduce the inflammation, that means redness and swelling, and bring down the high temperature, that means fever. NSAIDs are used to treat a wide range of conditions like a headache, painful periods, toothache, sprains, common cold, inflammation of the joints, that means arthritis, and other tissues. NSAIDs work by blocking the production of prostaglandins, chemical messengers that often are responsible for the pain and swelling of inflammatory conditions. Next, coming to the classification of the drugs NSAIDs, these are mainly classified into 9 categories, and here I mention the different categories of the drugs, and here I mention the drugs which are present in your syllabus. According to the PCI syllabus, I framed this classification. Coming to the first category, salicylic acid derivatives. Salicylic acid derivatives drugs, example aspirin, sodium salicylate. Second category is para-aminophenol derivatives. Examples acetaminophen, also known as paracetamol, phenacetin. Indole and indane acetic acid derivatives. For this category drugs, examples indomethacin, sulindac. And fourth category is anthranylic acid derivatives, drug examples mefenamic acid, meclofenamate. The fifth category is aryl propionic acids, drug examples ibuprofen, naproxen. Sixth category is heteroaryl acetic acids, drug examples tolmetin, diclofenac, ketorolac. Next category is enolic acids, oxycams. For this category, drug examples piroxicum, tinoxicum. Next category is pyrazolidinones, drug examples phenylbutazone, oxyphenbutazone. Finally, miscellaneous drugs, example zomipirac, antipyrin. All these drugs are comes under non-steroidal anti-inflammatory drugs. Let us see the drugs one by one with IUPAC name and uses of each and every drug. The first drug is salicylic acid derivatives. Under salicylic acid, the first drug is aspirin. This is the structure of aspirin and it is a salicylate derivative. Let us see the IUPAC name of the aspirin. And here at second position it is attached with acetoxy, that means acetyl, CH3C double bond O group, acetyl. oxy. This is oxy. And benzene with COOH group is known as benzoic acid. 2-acetoxy-benzoic acid is known as aspirin. Let us see the uses of aspirin. And at introduction itself, I told that the uses of NSAIDs, these are used to reduce the pain, fever and inflammation, used to treat specific inflammatory conditions associated with Kawasaki disease. Kawasaki disease, it is an inflammation in the walls of the some blood vessels in the body, is known as Kawasaki disease, and it is most common disease in infants and young children. And pericarditis and rheumatoid fever. This drug also used for the treatment of pericarditis and rheumatoid fever. Aspirin, it is a very important point. Aspirin given shortly after heart attack. It will be decreases the risk of the death. Aspirin is also used long term to prevent the further heart attacks and ischemic strokes and blood clots in people at high risk. Next drug is sodium salicylate. This is the structure of the sodium salicylate, and it is available as salt form of the sodium, that is the sodium 2-hydroxy. Second position, it is attached with the hydroxyl group and it is in a benzoate. Sodium 2-hydroxy benzoate. Let us see the uses of sodium salicylate. Used as analgesic and antipyretic, also act as non-steroidal anti-inflammatory drug, and it induces the apoptosis in cancer cells and necrosis. It is also a potential replacement of the aspirin for people who are sensitive for the aspirin. Next drug is mefenamic acid. This is the structure of the mefenamic acid, and when you observe the IUPAC name and at this ring, so this is the substituted ring, at second and third position substituted with 2 methyl groups, that is 2,3 dimethyl. This is a 2,3 dimethyl, and this is the phenyl moiety, and 2,3 diphenyl dimethyl phenyl, and at the second position this chain, this substitution is present at second position of the basic nucleus, and this side moiety is attached with the amino group. No, that's why I written it is amino, and this benzene with COOH group is known as benzoic acid. Let us see the uses of the mefenamic acid. Mefenamic acid is a member of the anthranylic acid derivatives, and it is in a class of non-steroidal anti-inflammatory drug, you know very well, and it is used to treat mild to moderate pain including menstrual pains. This is regarding mefenamic acid. Next structure is meclofenamate. This is the structure of meclofenamate. It is available as a sodium salt. This is sodium salt of the 2,6 dichloro. This is second position and sixth position attached with the chlorine atoms, that's why called as 2,6 dichloro, and third position it is attached with the methyl moiety 3 methyl, and this is a phenyl moiety, this is a phenyl, and this is attached with the bridge atom. Here the bridge atom is nitrogen, that is amino, and totally it is in a benzoate. It is in a I already told that it is in a sodium salt, and finally it is in a benzoate. This is the structure of the meclofenamate, and let us see the uses of meclofenamate. It is used for the joint, muscular pain, arthritis pains and dysmenorrhea. That means painful periods. Next drug, indomethacin. This is the structure of the indomethacin, and coming to the IUPAC name of the indomethacin, 4-chlorophenyl. So this is the fourth position, chloro, and this is the phenyl, 4-chlorophenyl, carbonyl, this is the carbonyl, 5-methoxy, this is 5-methoxy. Second position, it is attached with the methyl group, this is the 2-methyl. 1H indole, this is the basic nucleus is here, it is indole basic nucleus. And third position, it is again attached with the side chain, it is acetic acid. So this is the IUPAC name of indomethacin. Next, coming to the uses of indomethacin, it is used in rheumatoid arthritis, spondylitis, osteoarthritis, gouty arthritis, acute painful shoulder bursitis, that is nothing but inflammation of one or more bursae of synovial fluid in the body and headache in the body, and it is also useful for the treatment of headache. Next, coming to the Sulindac drug, this is the structure of Sulindac, and let us see the IUPAC name. 5-fluoro, this is substituted with fluorine atom at 5th position, and 2-methyl, and this is the 2-methyl, and at the first position it is attached with the side chain, it is 4-methyl sulfonyl, this is at 4th position, it is attached with methyl sulfonyl. And benzylidene means it is in a benzene, and it is attached with, at first position it is attached with double bonded C, double bond C, no, that is benzylidene. And the basic nucleus, here it is indane nucleus, 1H indane. Third position, it is attached with the side chain moiety. So 3-yle represent the some side chain is attached at this position, and the side chain name is acetic acid, CH3COOH, acetic acid. This is a structure and IUPAC name of Sulindac. Let us see the uses of Sulindac. It is useful in the treatment of acute or chronic inflammatory conditions. Next drug is tolmitin. This is the structure of tolmitin. Let us see the IUPAC name, and it is attached with 1-methyl. This is the 1-methyl, and 5th position it is attached with the side chain moiety. This is the side chain moiety. The name of this, it is 4-methyl benzoyl. This is the 4-methyl. Fourth position methyl group. Benzene with C double bond O is known as benzoyl. And 1H pyrrole. This is a pyrrole basic nucleus. And 2-yle means second position, it is having one more attachment that represents the 2-yle condition, 2-yle, and at this position it is attached with the acetic acid. So CH3COOH, acetic acid. So this is the IUPAC name of tolmitin, and let us see uses of tolmitin. Tolmitin is used to relieve the pain and tenderness, swelling, stiffness caused by osteoarthritis and rheumatoid arthritis, etc. Next one is Jomipirac. This is a structure. Let us see IUPAC name, and it is attached with 4-chlorobenzoyl. So this is the 4th position, attached with chlorine atom, and benzoyl means benzene with C double bond O group is known as benzoyl. And first position, 4th position, attached with the dimethyl. This first position, this is and here it represents the methyl group CH3, and 4th position also it represents the one more CH3, that means 1,4 dimethyl pyrrole. This is the basic nucleus is pyrrole, and second position it is attached with some more attachment. The name of the attachment is acetic acid, 2-yle acetic acid. This is the IUPAC name of the Jomipirac. Next, coming to the uses of Jomipirac, effective non-steroidal anti-inflammatory drug that has antipyretic action. It will reduces the temperature, that is known as antipyretic. Next one is diclofenac drug. diclofenac, the name itself it indicates the chlorine atoms are substituted. 2 chlorine atoms are substituted in the drug moiety, and the positions are second and sixth position. Chlorine atoms are attached. That's why I written here 2,6 dichloro, and it is phenyl moiety. Phenyl amino means this bridge atom is amino, and it is again at the second position. It is attached with the phenyl acetic acid. This ring is known as phenyl, and in this side chain it represented as acetic acid. Let us see the uses of diclofenac. Diclofenac is a medicine that reduces the inflammation and pain, and it is used to treat aches and pains as well as problems with joints, muscles and bones. This includes rheumatoid arthritis, osteoarthritis and gout. Next drug is ketorolac. Ketorolac, this is a structure. Let us see the IUPAC name. It is a 5-benzoyl. I already said that benzene with C double bond O, it is benzoyl. 2,3 dihydro, and where the lack of double bond 2,3 dihydro. 1H pyrrolizine, this is a pyrrolizine basic nucleus, and 1 carboxylic acid. The first position the carboxylic acid is attached, that is carboxylic acid. Next, let us see the uses of ketorolac. It is used for short-term management of moderate to severe pain. It is also used to treat dysmenorrhea, and that means painful menstrual cycle. And ketorolac is also used as eye drops. It can be given during the eye surgery to help with pain, and it is effective in treating ocular itching. This is very important, and this is a different point where we can use it as an eye drops. That is one of the best example, ketorolac. Next one is ibuprofen. Ibuprofen, this is a structure of ibuprofen. Let us see IUPAC name, that is 2-methyl propyl. So here 2-methyl propyl, let us see the numbering 1 and 2. 3. At second position methyl group is present. This is a 2-methyl. Totally 3 carbon atoms are there. Propyl, and it is attached with the phenyl moiety. This is the phenyl, and propionic acid. So totally 3 carbon atoms are there. 1, 2, 3, 3, and it is attached with the COOH. That's why it is propionic acid. This is a structure and IUPAC name of ibuprofen. Let us see the uses of ibuprofen. It is used primarily to treat fever, including the post-vaccination fever. Mild to moderate pain will be treated with the ibuprofen, including pain relief after surgery, and painful menstruation will be also treated. Osteoarthritis, dental pain, headaches and pain from the kidney stones also will be relieved from the ibuprofen. Next one is naproxen. This is a structure of the naproxen. Let us see IUPAC name, and at the 6th position it is attached with methoxy. So this corner indicates the presence of the methyl group methoxy, and the basic moiety here it is a naphthalene nucleus. This is the naphthalene basic nucleus, and naphthalene basic nucleus attached at the second position. It is 2-yle, that means side chain is attached here, and it is propionic acid totally, and this corner also indicates the presence of the CH3 1, 2, 3. So 3 carbon atoms are there, that is propionic, and it is an acid. Carboxylic acid, no, that's why we can call as propionic acid. Let us see the uses of naproxen. Used to treat the pains, menstrual cramps and inflammatory diseases such as rheumatoid arthritis, and also used for the treatment of fever. Next drug is piroxicum. This is the structure of piroxicum, and it will exhibit the keto-enol tautomerism. Here the double bond is there, no, this double bond can be shifted to here, and at that time it forms the OH group. It forms OH moiety. That's why when we observe the IUPAC name, it is 4-hydroxy. Whenever it exhibits ketoenol tautomerism, and because of presence of hydroxyl group, it is 4-hydroxy. And at the second position, it is attached with the methyl group 2-methyl. The first position, 2 dioxo groups are there. 1,1 dioxo N-pyridine. It is an N-pyridine 2-yle, N-pyridine 2-yle benzothiazine. The basic nucleus here, it is benzothiazine basic nucleus, and it is a 3-carboxamide. Third position, it is attached with C double bond ONH and with this nucleus. That's why we can call as 3-carboxamide. And next, coming to the uses of the piroxicum, it is used in the treatment of rheumatoid and arthritis, and primary it is used for the treatment of dysmenorrhea, and also used for the treatment of post-operative pain, and it is act as an analgesic agent. And next drug is phenacetin, and this is the structure of phenacetin. Let us see IUPAC name of phenacetin. At fourth position, it is attached with ethoxyphenyl. That means ethoxy, we can call as ethoxy or ethoxy, and it is in a phenyl moiety, and it is attached with the acetamide. N,4-ethoxyphenyl acetamide is known as phenacetin. Let us see the uses of phenacetin. It is a pain relieving and fever reducing drug. And next drug is acetaminophen, also known as paracetamol. This is the structure of paracetamol. And the IUPAC name, it is 4-hydroxyphenyl. The fourth position, it is attached with the hydroxyl group, and this is the phenyl moiety. And next, it is attached with the acetamide group. N-hydroxyphenyl acetamide is known as paracetamol. Let us see the uses of paracetamol. Used for reducing the fever in people of all ages, and also relieves the mild to moderate pain. Next drug is antipyrine. This is the structure of antipyrine. Let us see IUPAC name, that is 1,2 dihydro. This lack of this double bond, no, that's why we can call as 1,2 dihydro, and 1,5 dimethyl. The first position and fifth position, it is attached with the methyl groups. So 1,5 dimethyl 2-phenyl. Second position, it is attached with the phenyl moiety 2-phenyl, and the basic nucleus here, it is pyrazole. Third position, it is attached with keto group, that is C double bond O. We can represent it as 3-one. This is the structure of antipyrine and IUPAC name. Let us see uses of antipyrine. It is used as analgesic and antipyretic agent. It is a non-steroidal anti-inflammatory drug. Let us see phenylbutazone. This is the structure of phenylbutazone. IUPAC name of phenylbutazone is 4-butyl. At the fourth position, it is attached with the 4 carbon atoms, 1, 2, 3 and 4 carbon atoms, that is 4-butyl. 1,2 diphenyl, the first position and the second position, it is attached with the 2 phenyl moieties, diphenyl. Pyrazolidine, the basic nucleus here, it is pyrazolidine, and the third and fifth position, it is attached with the ketone groups, that is C double bond O group 3,5 dione. This is the structure IUPAC name of phenylbutazone. Let us see uses of phenylbutazone, and it is used in humans for the treatment of rheumatoid arthritis and gout, but it causes severe adverse effects such as suppression of white blood cell production and aplastic anemia. It causes aplastic anemia. It is a severe side effect. Next, so we completed this NSAIDs classification, structures, IUPAC names and with the uses. If you like this video, please subscribe to this channel. Thank you for watching.